In a healthy body, the plantar fascia, the heel pad and the Achilles tendon should be one continuous functional unit. Remember, the heel pad is a connective tissue plate that should be able to slide several millimeters in relationship to the heel bone underneath. So here, in my patient, you can see I can move the heel pad 4 or 5 millimeters in one direction and the same amount in the other direction. In many of your less mobile clients, you can only move it 1 or 2 millimeters. And then the tension transmission is interrupted, and that is as disastrous for your everyday life elastic recoil and force transmission as if your patella would no longer be able to adapt to the tension of the quadriceps above and of the knee angle below. So what do you do when the heel pad doesn't slide as much? You can use your knuckles in order to push it in one direction or the other direction. I've been doing that for many decades in my roughing practice, but at the end of the day, often I couldn't bend my fingers anymore, and I lost sensitivity because the heel pad is used to have body weight on it. And you need to be somewhere in the same region of force, and that is often too much for my hands. That's why the wave tool is wonderful here, because you can accumulate the main contact force on a few millimeters here, depending on whether you use the smooth surface or whether you use the sharp surface here. And that is ideal, particularly with the indentation for the thumb here. So here I can grab the heel pad and push it into the distal direction here, for example. And then I can ask the client in slow motion to dorsiflex the foot, extending the heel. Okay, once more, slow motion, very nice. And then with her assistance, I'm pushing the heel pad a few more millimeters into one direction. I can also do it in this direction, then without her assistance. And afterwards, you can already see that the sliding capacity has increased. After you have mobilized the heel pad, it would be very nice to also look at the Achilles tendon. And the main tissue that we want to focus on in manual therapy is not the tendon itself, but is the fascial envelope around it, which is part of the fascia cruris. This is where most of the cells that are repairing the Achilles tendon, if you have some strain or micro injuries, they are located in the paratenon. So with my hands, I would work in the groove on one side or the groove on the other side in this way. And usually you would just have one finger tip that fits into this gentle groove. If they have Achilles tendinopathy, you can very often palpate some bumps here, some swelling and stiffening zones. Now with the wave tool, it is ideally made that you can go into the groove here by putting one finger into the indentation, and then I can much more precisely distribute any tissue hardenings on that side. And here I can ask the client again to slowly dorsiflex the foot while I go against her in this direction. Come back, and once more, once more, once more, once more. Very nice. And this you can do much more detailed than you would be able to do with your own hands.